Hello friends, welcome to Module 6. So this one was a lot about the Lancet series. So the first question was, what surprises you the most about the Lancet series? So I really liked that the whole basis of this series uses evidence that we currently have to describe midwifery care as women and babies need it, and I really liked that. It was not how we need it professionally, but how women and babies need it, and they actually used women's views, it sounds like, to find out what makes a difference for them rather than only using a professional perspective. And I feel like that is kind of a foreign concept when talking about medical frameworks that determine how we implement medical practice. So, when you're reading a research study or reading about ACOG, you don't usually read about having a patient's perspective or knowing what really makes a difference for the patient. It's more just about the evidence that drives it, which is not a bad thing. This was just something different that I really thought was cool. And I also liked the idea that the Lancet series can be utilized to monitor and assess how a health system is working. I think that that's really important to continually evaluate the care we're giving if we're going to continue to always evolve and change health outcomes. So I like the idea that it could be used to assess how a healthcare system is working. Because sometimes I think we need to check that. It's important. I also loved how they emphasized optimizing women's own capabilities. So really providing that hands-off care unless it's absolutely needed, and really just emphasizing that women's bodies can really do it if we just leave them alone. I really liked that notion. They also discussed that one of the characteristics of provider in this framework is that they are integrated with other healthcare providers. And so I liked that because it's not exclusive. Midwifery practice really wants to work with other professions and various levels of care providers. It's not an opposing force. They also talked about the framework was something that was culturally sensitive. It's not a one-size-fits-all, which I think is so important. And I think in the medical world, we really like things to be cookie cutter and textbook. And so we make these textbooks and this research all around saying that XYZ occurs in every woman, and that's not really how it works. We know that not one size fits all, and that every case is different, every woman is different, and our care should be super individualized. My favorite part of this whole framework was that they stress that all women and infants need a certain basic kind of care, and then there are some of those women that might need additional, more complex care on top of that basic care that everyone should have. So they're not dividing the care into low-risk women receive this kind of care and high-risk women receive this kind of care. They reiterated that all women really need that basic care founded in this framework, and just some women need additional care in addition to that, not aside or separate from that. So the next question was, how will you use this evidence professionally to answer questions from interprofessional collaborators who are not as aware of the profession as you now are? I think that it's really important for us to explain that the evidence supporting midwifery is not an opposing force. It actually, harmonizes all that evidence together and simply strives to lower neonatal and maternal death rates and really improve care. So the Lancet series is a really good example of this, because after so long, there's finally this evidence grouped together that will drive a different framework and has the same goals as other professionals. We're all on the same team, really aiming to improve health outcomes and quality of care for infants and mothers. And I really appreciated the evidence that they used to illustrate that this framework really works, using that Lives Saved tool, where they took the 78 countries and divided them related to human development, and they implemented this framework in those countries that we're talking about, and it showed that the number of deaths decreased. So It really proved that midwifery care and midwifery type interventions really do make a huge difference in changing countries and literally saving lives. So if this is a common goal that all types of providers have, which I would at least, I would hope that this is a goal we all share, is to improve the lives of mothers and infants and to decrease mortality rates, then I really believe that this commonality is the ground for bringing all of the professions together to improve the care and outcomes of mothers and infants. So I feel like if this is truly all the same goal, then you can use those goals as a common ground to reach out to other providers and also use this framework to, tell them it really does work and the evidence shows it works and we are working towards the same goal. The last question is, what will you do to step up your impact on the world of midwifery? So I think that it is important as a midwife to be the driving force that not only implements this framework, but also works with and not against other providers so that we can all finally really truly work together collaboratively. This collaboration could seriously change the OB world as it is in our country right now, and I think to be a changing agent in that movement, it's my professional goal to not just implement this midwifery framework, but also to educate other providers on the frameworks of midwifery and how it can really affect their outcomes and what it can do for them, how it can help them and their patients so that we can really all work together towards those same goals. So my follow-up questions, the first one is, how have you encountered other professionals working against that driving change, or what have you seen that makes it really hard to make that change occur? And then my second question is, have you seen healthcare providers working against midwifery? How have you seen the ignorance and the lack of knowledge about midwifery come up in your place of profession? And that's it. Thanks, guys.